Good evening, everyone. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. Few of the very common conditions affecting the look and feel of a person is acne, hyper or hyperpigmentation, and even hair loss. Out of these, acne is a very big concern. Acne is a very common skin condition that can impact anyone. Whether you are a teenager or an adult, this skin complaint is no stranger. Knowing the various types of acne can actually help you to treat the condition better. Acne vulgaris is a chronic condition affecting more than 85% of us adolescents and young adults. It is one of the most common diseases affecting humanity and the quality of life. It goes beyond just being a skin ailment to various psychological disorders such as depression, anxiety, stress, and low self confidence. Hence, it is very important to know about the holistic treatment approach of this very ailment. Despite its prevalence, few people know that June is Acne Awareness Month. Acne Awareness Month was launched to combat the negative stigma surrounding this very common skin condition and also to be aware of treatment approach for acne management. So let's connect today with our skin expert, Dr. Somashekar, live from Bangalore, to talk on do's and don'ts in acne management. Dr. Somashekar is a consultant dermatologist from Bangalore. He has done his MBBS from KIMS Bangalore. Later, he pursued his post-graduation specialization in DVL from JTM Medical College, Davangere. His key area of interest are anything related to skin care. It's such a pleasure to have you with us, Dr. Somashekar.
Thank you, Saika, for the amazing introduction.
And Doctor, today we are going to talk about do's and don'ts of acne. So before we start with do's and don'ts of acne, kindly let us know what is acne?
Okay, so acne, like you said, is a very common skin condition. I think everyone must be aware of it. So you see these young teenagers and the young adults coming out, they're having a breaking out of these pimples on the faces. So that medical term for that is called acne. So it is basically caused when your pores are clogged by dead skin and there's accumulation of your oils. So so on the face, it can be as simple as comedones, it can be blackheads, whiteheads. It can also present as angry-looking pustular lesions. These acne lesions are commonly seen over a face, neck, shoulder, and back. So it's a pretty fairly common condition. I don't think acne needs any introduction. Everyone must be aware of what it is.
Right. And doctor, who all can develop acne? Who are prone to acne?
So acne is commonly seen in teenagers and young adults. So it's commonly seen in the age group of 12 to 24 years. But there are a few percentage of patients in whom the acne continues on to the adult life as well. So in those specific, in those small group of patients, there's usually an underlying cause. Usually we see commonly in female patients suffering with PCOS. So they have acne well into their adult life. And we also see acne in patients taking any kind of corticosteroid therapy or anabolic therapy. They are applying any kind of steroids. So with that said, there's many reasons of adult onset acne. But acne is seen in adults as well, but the majority is seen in the age group of 12 to 24.
Okay. And you said that, due to excessive oil secretion or the accumulation of dead skin, acne can be formed. What are the other causes of acne, doctor?
So there are multi-factors acting together to cause acne. So one factor is your genetics. So it's commonly run in families. So severity of acne is commonly runs in the families. So factors like hormonal increased hormone production when you reach your puberty, that is, there's increased androgen production. So it's a combination of this. It's a combination of infection by Propionibacterium acne, which is a common bacterium seen on your skin. A combination of stress and accumulation of oils due to a blockage of the ducts. So all these add synergistically to form acne.
Right. And doctor, how do we manage it?
Okay, so managing is best left to the dermatologist. We use many modalities of treatment. So topical, We use topical antibiotic agents. We use topical vitamin A analogs. We sometimes even use systemic antibiotics like azithromycin, macrolide group, and basically doxycycline, tetracycline group of drugs. So it's best left to your dermat. So first we'll have to determine what is your skin type, whether it's dry skin, it's oily skin, or your combination skin. So based on that, we'll have to see what treatment works for you best.
Right. So the bottom line is, in case one have acne, one needs to go and consult a qualified dermatologist, because what we normally do is do a lot of or experiment with a lot of home remedies or go for over-the-counter medication. We'll talk about that also later when we talk of do's and don'ts. But before that, doctor, diet seems to play a very important role in acne management or outbreak of acne. Is there any science behind it, or if so, what kind of diet can actually worsen or improve acne?
Okay, so we usually have patients who are on high glycemic diets. So basically, you see this young kids eating a lot of junk food. Like basically, high glycemic index diets are those diets, those foods when consumed, they spike up your blood sugar levels. So they can be your sugars, your chocolates, your fried foods, your processed foods, fast foods, burgers, pizzas, chocolates, your ice creams, and all kinds of junk foods are ones which have high glycemic index foods. So people who consume these foods on a daily basis, they seem to have worse case of acne compared to those kids who do not consume this kind of diet. So the diet does play a role in acne. So it's always best to avoid these kind of foods. So it's always best to avoid sugars, dairy, keep the dairy and the meat to the minimum, because you cannot eliminate them from your diet. They are very essential for your growth, but limit them. So keep them from minimum. Try to avoid sugars. Try to avoid processed foods, fried foods. Basically, all kinds of junk foods have to be avoided. So try to include a lot of whole vegetables, whole fruits and nuts, complex carbohydrates into your diet. So these kind of diets helps in the acne management. So basically,
Fair
you'll have
enough.
to consume a lot of foods which have low glycemic index, so they do not cause a sudden peak of blood sugar levels.
Right. Okay. And doctor, we always hear a lot about regular skincare routine, and we know
Okay.
that it will keep our skin, better, healthy, and acne-free, maybe. So, what is that ideal skincare routine that we can follow, especially to control acne?
Okay, the best skincare routine, according to me, I feel the less the better. Nowadays, we see patients coming to us saying that I found this on Instagram, I found this on YouTube, I tried this on my skin, but it did not work out for me. So always for your skincare routine, consult your dermat. They'll again be able to determine what is your skin type, and based on that, they'll give you a tailor-made skincare routine. So basically, the minimum things which you're supposed to use, we'll have to use a cleanser. So cleanser is something which gets rid of the dead skin and dirt and oil from your skin. So basically, the face washes which you use, they can be medicated. So the kind of face washes to be used are again to be determined by a dermat. So we can use a face wash with salicylic acid. Say your skin is very oily, you can use a face wash with salicylic acid. And your face washing also should not be it should not be done too many times. So once in the morning, once in the evening should be more than enough. If you if you excessively wash your face, it ends up drying your skin, which can irritate your skin. So use a good cleanser, which is recommended by your dermat, followed by a moisturizer. So the common misconception is people who have this very oily skin, they say, "Sir, my skin is very oily. Why do I need to use a moisturizer?" Right. So even if your skin is very oily, you need to use a moisturizer because there is a feedback mechanism. So if the skin is dehydrated, that there's no proper hydration, there'll be increased production of oils again, which will end up making the skin more oily. So it's always recommended to use a moisturizer, thin moisturizer which does not occlude your pores. So whenever you're picking out a moisturizer, you should look for the word non-comedogenic. So the word non-comedogenic means that they do not block your pores, thereby aggravating acne. Again, you need to consult your dermat to see what brands they would recommend. I'm sure any dermat would be able to do so. So following this, a sunscreen is a must. Sunscreen is very important. So why is the sunscreen important? So you generally see after the resolution of acne, it leaves behind a black mark. So that happens when the clients, they usually pick their pimples or do something with the pimples that leaves behind a black mark. So to prevent this pigmentation, it's always good to use a sunscreen. And sunscreen also reduces the oxidative stress caused by UV rays. So it's always good to use a sunscreen. So whenever using a sunscreen, whenever you're picking out a sunscreen, it should be at least 30 SPF. It should give you dual protection of UVA, UVB. If it has an additional blue light filter, nothing like it. It's really good. It should be water resistant. It should have matte finish. And the main thing in acne prone skin, it should be non-comedogenic. So you should always, whenever you're applying, when if you're suffering from acne and if you decide to experiment with yourself, always look for the word non-comedogenic on your skin products. So that means they're not going to aggravate your acne.
Right. I'm amazed at, how with limited words and in limited time, you have explained so well ideal skincare routine, especially for acne prone skin. So a cleanser, a moisturizer and a sunscreen is what you need. And in case of any doubt, please go and consult a qualified dermatologist. They'll help you, sort out the best thing for you. Now, doctor, coming to the main topic, do's and don'ts in case of acne. Do's and don'ts in reducing acne and the complications related to acne. So what's your, first thought, or what's generally that you normally, advise your patients about?
So whenever I get a client who has acne, I tell them not to pick their pimples. So most of them have the habit of, trying to remove the sebum out of their acne. So what it does, it leaves behind a mark. In worst cases, it can also leave behind scars. So to prevent complications, kindly do not touch your face. Kindly do not pick your pimples. Repeated touching your face can, again, there'll be many bacteria on your palm. So, you can infect your acne lesions, causing them to be pustular. So kindly avoid touching your face on a regular basis. Popping your pimples is a big no. So the only times when you're touching your face is when you wash your face and when you're applying any skincare products. Other than that, you should keep your hands off your face. That's a big thing which should be kept in mind. So that is the number one thing which I advise my patients. I tell them always to clean their phones regularly. That's one more thing. So your phone is a good breeding ground for bacteria. So when you get it in touch with your skin on a regular basis, all your comedones get infected and they become red and pustular. So regularly clean your phone, regularly change your pillow covers, then follow a good diet. Like I said, follow a diet which has low glycemic index. Basically cut out all junks, minimize your carbs, include a lot of fruits, include a lot of vegetables, seasonal fruits and vegetables, lots of nuts in your diet. So that is one more thing. And the big don't is do not experiment with yourself. Do not go to a pharmacist asking him, sir, please give me a cream for my acne. What they do, they'll end up giving you a steroid cream. So you'll end up damaging your skin and also aggravating your acne. So please do not self-medicate. Please consult a dermat for your skincare routine. So this is the big problem. If you have any concern, not just acne, if you have any problem concerning your skin, go to a dermat. I'm sure if you are having some kind of chest pain or something related to your heart, you won't self-medicate. So skin itself, again, is the same kind of an organ. So you should not take it for granted. Please consult a dermat for proper, skincare. I think I went off topic. So do's and don'ts, right? Diet and stress is one more thing. So learn to manage your stress properly and get enough sleep. So stress, you can manage stress by regularly exercising or, starting stress managing activities like, yoga, meditation, and all that. So basically, don't pick your skin. Get your advice from a dermat. Don't experiment with yourself. Keep your pillows clean. Regularly change them at least 3 days once. Keep your phones clean. And if you have the habit of oiling your hair, just oil your hair 2 to 3 hours before head bath. So what happens when you oil your hair, because of sweat, the oil can drip down onto your face and it can again clog your pores and aggravate acne. So these are the few things off the top of my head. So yeah.
Right. And many times, people question that, can I use makeup in case I have acne? What's your general advice?
So my advice is to reserve your makeup for those occasions when there are events. So say you have a marriage to attend or you have a party to attend or for, just for those kind of events, but it should not be a day-to-day thing. So if it's a day-to-day thing, basically many products contain oils which can clog your pores and aggravate your skin. And if you're using it, make sure that you remove them before going to sleep. You wash your face, apply moisturizer, and then go to sleep. However, you're tired, to do your skin a favor, please wash your face, apply a moisturizer, and go to bed. So try avoiding foundations on a regular basis. If you want to use something on a regular basis, try using concealer only on the acne lesions. So that you can use on a day-to-day basis, and use mineral-based foundations and all that, because they don't have any oils which won't occlude your pores and aggravate your acne. So I feel with the concerns to make up, just keep it for those occasions where you have to attend any events or functions, and it should not be a regular day-to-day thing.
Right. Doctor, any SOS treatment when one have, an acne breakout just before an important event?
So yeah, basically you should run to your dermat. They'll give you a prescription for benzoyl peroxide. It's a benzoyl peroxide, basically a short contact benzoyl peroxide works wonders. But mild corticosteroid with antibacterial agent will be able to reduce your acne, but it should not be used for a long term. If it's used for a long term, it will again aggravate acne in the long term and damage your skin as well. It can be used 1 or 2 days before an event to reduce the size and redness of the pimples. So that is just like an SOS treatment. So usually we have these patients who are having 1 or 2 breakouts before some main important event. So you can just prescribe a mild corticosteroid. I'm sure we go to any dermat, they'll be able to do so. Use them for 1 or 2 days before your event. Once your event is done, stop the steroid and get back to your normal routine.
Right. And there are so many chemical peels, etc., procedures available for managing acne and acne scars and acne marks. How, useful are they? How effective are these peels and all, doctor?
Okay, so before I come to how effective and how useful they are, first let me tell you what a chemical peel is. So it's basically it's a non-toxic, acid which we apply on your face. So what kind of acid we apply, it depends on the condition. For example, we don't use the same peel for acne. We don't use the same peel for pigmentation. We use completely 2 different products. So basically, we apply a non-toxic peel on our face, leave it on for I think 5 to 7 minutes. It again depends on the kind of peel which is being used. Then we neutralize it. So once we neutralize it, you will see the desired effect. So in acne-prone skin, basically we use a salicylic acid peel. So what salicylic acid does? So we apply a layer of salicylic acid peel on your face, leave it on for 5 to 7 minutes. After 7 minutes are done, we neutralize it. So once we neutralize it, so that's the end of procedure. Okay, so what salicylic acid does, how is it different from the salicylic acid creams which are available? So the concentration of salicylic acid in peels are very high. So there are chances that you can burn yourself if you're not careful, but that doesn't happen in creams. In creams, the percentage, the concentration is just a fraction of what it is in peel. So a chemical peel is a medical procedure which should be done by a trained practitioner, a trained dermatologist. So commonly we use a salicylic acid peel in acne. So what salicylic acid does, it reduces the size of your oil producing glands. So thereby your oil secretion on the face reduces, which again gives a beneficial effect in acne. It again has an effect of mild exfoliation, which declogs your pores. So salicylic acid peel works wonders in preventing relapses of acne.
Right. And how important is the use of sunscreen, especially after such procedures?
It's very important. Say you have a mild burn because of the peel. So from it to prevent it from leaving behind a mark, a sunscreen is very important. So most of the peels, for example, you're getting a yellow peel, which is done in case of pigmentation. Sunscreen is a must because yellow peel contains retinol. It makes your skin more sensitive to the sun. So if you're not careful with your sunscreen use, if you're not regularly using your sunscreen, you can end up having a lot of pigmentation on your face. So post any kind of peel, sunscreen, moisturizer, and a sunscreen is a must.
Right. And doctor, with the increase in ours, because quackery is so rampant, there are so many quacks. There are parlors who claims to have these chemical peels or procedures to help manage acne. What's your stand on these quacks, parlors, etc.? How harmful or dangerous it could be to go to these stations?
Like I said, so always be very careful whom you take your advice from. Always be very careful whom you get these procedures done from. So before you take any kind of advice from someone, you just think about, are they the right person to give you the advice? What are the credentials? So we study 5 years. MBBS is 5 years. On top of that, we study 3 years as an MD. So the minimum thing. So we study 8 years to understand how skin works and what kind of treatments are good. So do you think the same kind of advice can be given by any layman or a beautician working in a parlor? So you should do a wise decision of whom you should take your advice from. There are always going to be quacks. will be looking to take you for a ride. So you should be careful and please stay away from them. Always, consult your dermat for your medical concerns, your skin concerns.
Right. Dermat gives their life in studying and understanding the skin types, etc. So it's always advisable to go to the right person, which is a qualified dermatologist. In case we have some kidney related issues or heart related issues, we'll never go for quacks. We'll go for, a qualified and good cardiologist or nephrologist. But I think we love experimenting a lot with our skin and we love risking it. So don't do that. Don't waste your energy, time, your money, and most importantly, your health. And please go to an expert, a qualified dermatologist. Doctor, we also hear a lot about use of serum in acne or to prevent acne, right? So we would like to know your opinion about the use of serum in acne or any do's or don'ts of acne with respect to serum.
Okay, so serum, there's a lot of commercially available serums now you can order. You can pick them one of your health and glow store and all that. So don't try an experiment. Again, go to your dermat. They'll be able to determine what is your skin type. And based on that, they'll be able to prescribe a serum for you. So basically, serum is nothing but that skincare product, which is designed to deliver a medication at a higher concentration. So it is more effective than your normal creams. At the same way, it can be more dangerous than your normal creams if something goes wrong. So there are a lot of serums now. There are niacinamide serums, vitamin C serum, salicylic acid serum, azelaic acid serum, your retinol serum. So for your acne, salicylic acid can be used. Azelaic acid serums can be used. I do not believe in using retinol for acne, but some people do use retinol for acne because it causes exfoliation. I just keep retinol for anti-aging purposes, but not for acne. So if you're looking to use any serum for acne, you please consult your dermat. So I believe based on your skin type and based on your severity, he'll be either able to give you a niacinamide, a salicylic acid, or an azelaic acid serum.
Right. And doctor, your opinion about isotretinoin tablet use in acne?
Okay, so isotretinoin is something which always works wonders in acne. So I generally reserve it for my patients who are recalcitrant to the normal treatment. That is, they do not respond to the normal treatment which we give. So then we give isotretinoin. With that being said, isotretinoin will clear your acne. You won't even have one spot on your skin. But with all that said, it's a very toxic drug. So before we start off isotretinoin, we'll have to run a few blood tests. We'll have to see how is your kidney function, how is your liver function, see what is your cholesterol levels. Because your isotretinoin is known to alter all these factors. It is known to alter your liver enzymes. It is known to alter your kidney function. It is known to cause dyslipidemia. And the main thing is it should never be used in people who are pregnant or for people who are planning for pregnancy. So I generally reserve isotretinoin for very severe cases of acne, that is nodular cystic acne, where you see big nodules, pustule lesions on the face, or acne fulminans, where acne is associated with fever also. So those kind of extreme cases, I just reserve isotretinoin for, and I don't use them on a day-to-day basis. And a big thing is, do not self-medicate yourself with isotretinoin. It's a very dangerous drug. I'm sure you'll find many videos about it online saying how it works wonders and all that. But it is a prescription drug which has to be prescribed by a dermat who knows what to look out for before starting you on, and who knows how to monitor you on when you're on the treatment, and who knows the side effects. So please don't experiment with toxic drugs like this. Best leave it to the experts.
Right. So please go and consult a qualified dermatologist. Again and again, we are emphasizing on this, why it is important to go and consult the right person, because there are so many influencers online. There are quacks, there are parlors, then there's home remedies, then there is over-the-counter medication, but none of them will actually diagnose or study your skin or why this problem is occurring. So they'll never go in the roots, only a doctor will. So we need to find out the cause behind the acne, and thus it's very important to go to the right person, which is a qualified dermatologist. Now, doctor, because initially also I mentioned that normally in our society we had this tradition or notion that first we'll try something, from the kitchen, home remedies to quick fix our acne, or else we'll go for over-the-counter medication. It's only when things really goes out of our control, we end up in front of a doctor, and that's when it's quite late because we have already done a lot of damage to our skin by those home remedies or over-the-counter medication. First, I would like to talk about home remedies. What's your stand on home remedies, or apply something? People, go to the extent of applying lemon or garlics on their acne. What's your say on that?
So my standard home remedies is don't do it. So it's not the right thing to do. There's no science behind it. Your home remedies are not proven. There's no proof that they actually work. So you end up applying all kinds of, like you said, lemon and whatnot, and it might cause dermatitis. So there's no proof that lemon improves your acne. If there was proof, you can go ahead and use it, but there's no proof. So my stance on home remedies is don't use it. For those people who are averse to allopathic medicine, who are averse to evidence-based medicine, who really believe in using stuff, naturally from the kitchen, you can use an ice pack on your red inflamed lesions. So they reduce the redness of the lesions. You can use an ice pack, or you can use a clay mask. So, but there's no science behind it. There's no proof behind it. It's again, if you want to experiment, you can experiment. There are again reports of tea tree oil, which again reduces your inflammation in the acne. People apply turmeric, which is supposed to have an antiseptic property. But again, there's no proof. So home remedies is, it's just experimentation. So we practice evidence-based medicine. If there's no evidence, we do not prescribe it.
Right. We always also, consult our friends or family members who have had acne, and we go to the extent of taking their prescription to the chemist and get the, ointments or pills, whatever, and start having it against self-medication. How dangerous that would be?
That's very dangerous. You can end up doing a lot of harm to your skin. So acne is seen in all kinds of skin. It's seen in oily skin. It's seen in sensitive and dry skin. It's in combination skin. So when you are getting the treatment from a dermat, he takes into consideration what is your skin type, how severe is your acne, and then he gives you a prescription. For example, say someone is trying for the pregnancy, and she picks up her friend's acne treatment, and the doctor's prescribed isotretinoin, and she takes isotretinoin, and she ends up being pregnant. So that's a really bad thing. So the baby can have birth defects. So it's extremely dangerous. So when the doctor gives you a medication, whenever he gives you a single cream, he always weighs the pros and cons. He knows what are the side effects. He will determine if you're the right candidate for it. So never pick up others' prescriptions and use the drugs of them, because it can do lots of harm, which you will never realize in the first place, until when you realize it might be too late for you to do anything. So it's a big no. I'll never do that.
Right. And again, initially also we talked about the, dangerous side of over-the-counter medication. You have already explained, but still, because, that is a very normal thing that people usually do. We'll go to the chemist, ask for a tube or something. And what happens? Initially, it works wonderfully on our skin, right? Whatever OTC, because they may contain topical steroids. So we feel that, see, it is working like a wonder. It is working like a magic. So we develop a kind of trust on those tubes, and we continue using them. And we see a lot of side effects. So what can these, especially creams containing topical steroids, how bad it could be for our skin, and what are the side effects that they cause?
So topical steroids are used only in conditions where you have dermatitis on your skin. So that is when there's some kind of inflammation going on due to a number of reasons. Say there is you applied some new cosmetic and you ended up having burning and itching after that. So you're allergic to that product. So we use the corticosteroid to reduce that inflammation or the redness and give you symptomatic relief. So what the steroid does, so when you go to a pharmacist and ask him for a steroid, usually gives you a combination, asking for a cream usually gives you a combination cream. More often, these creams contain a very strong steroid called clobetasol, which is never supposed to be used on your face. Say use this cream for a long time, your skin will become thinned out, okay? It'll start becoming wrinkly, there'll be depression, you'll start developing acne, you'll start developing, increased facial hair, there can be pigmentation, there can be redness, there can be itching, there can be flaking of the skin, there can be dryness of the skin. It's a big list of side effects which you see. So we see a lot of people coming to us. They would have used these creams called Betnovet, Pando, Betno, Skin Shine, Skin Light for months together. Then they come to us saying that, sir, my skin is burning. I can't go out in the sun. It's too dry. I cannot stop scratching my skin. Please help me. Then we ask them basically what did you apply. So every time they always say, so my neighbor asked me to apply this cream. I went to the chemist. They gave me this cream. So self-medication is a big no to start off with, and applying steroids on your face is a big no. So because they can damage your skin, beyond repair sometimes.
Right. We have Shabnam Khan with us. Her question is, can acne leave permanent scarring? If so, what can be done to minimize or treat acne scars?
Hi, Shabnam. Thank you for the question. So basically, acne, what kind of acne can leave behind scars? Acne which is very severe. Acne which is nodular. Acne which has big abscesses on your face. Those kind of acne leave behind scars. So the best thing to do to prevent scarring, say you have minimal, if you have just blackheads and whiteheads, avoid touching them, avoid popping them. So if you pop them, they can be scars, and get your severe acne treated. Okay, don't let people tell you that it's a normal phenomenon in our teenagers and all that, it will go away. Severe acne doesn't go away. It needs treatment to prevent complications. So one of the major complications of acne is acne scarring. So if you get scars, then again, the management of scars, again, a very long process where you have to undergo MNRF, CO2 lasers and all that. So prevention is better than cure. If you have severe acne, go to your dermat, get a prescription, and I'm sure they should be able to clear your skin of acne.
Treating acne is one thing, and treating acne scars and marks that it leaves is another. So yeah, definitely precaution is always better than cure. Anyway, doctor, to prevent acne, what we can do to prevent acne?
To prevent acne, like I said, so maintain a good lifestyle, hydrate yourself really well, at least 3 liters, 3 to 4 liters of water a day, exercise regularly, eat a good balanced diet, stop eating junk, keep your stress levels in check, regularly disinfect your phones, regularly change your phone covers, don't experiment with your skin, don't use all kinds of products which are available to you, keep your skincare routine to the minimal, and use just what is prescribed to you. And don't pick your acne, don't pick your pimples, leave behind the scars. So what was the question, ma'am? So how to prevent acne?
Prevent acne, yes, doctor.
Yeah, so to prevent acne, once your initial layer of acne is controlled, so there are a few things which can be prescribed by a dermat. So we can ask you to use short contact retinol like once a week for like 2 hours. So that causes mild exfoliation. If there's any clogging of pores, it will take care of it, which prevents relapse of the acne. So to relapse again, always lifestyle changes like maintaining a good diet, hydration, exercise, good sleep is very important. So if you don't get good sleep, it will again aggravate your acne. So yeah.
Okay, doctor. And many times people feel that, they associate acne with a dirty face. They'll keep on washing their face, especially people who have oily skin. They feel that, washing their face with a cleanser or face bag every now and then is what they need because, as much oil is getting secreted, they'll have more acne. What's the right approach, doctor?
So if you do not, however oily your skin is, do not wash your face more than twice a day. So what happens, more you wash your face, the more dry your skin is going to get. It is going to set in action the feedback mechanism. So your skin is going to sense that your skin is dry, and it will give a signal for the glands to produce more oil. So your skin ends up becoming more oily. So just keep your washing to the minimum, just twice a day, and after your face wash, a moisturizer should always be followed up. So with regards to repeated washing, I don't think it's going to help you with your acne. It's going to worsen the situation. Just keep it for twice in a day, once in the morning, once in the evening. Whenever you wash your face, follow up with a moisturizer.
Okay. And initially, when you were discussing about the importance of cleanser, moisturizer, and sunscreen for especially an acne-prone skin, you said that, all these three, cleansing, moisturizing, and sunscreen is very important. But with sunscreen, the problem is that people feel only when they are out, when they have, sun exposures, when they need to apply sunscreen. If they are inside, if they are working from home, or they are mostly in the kitchen, if their sun exposure is not that much, they feel that, sunscreen is just for when we are going out, for any vacation, beach vacation, etc. Why it is important, or why it is said that we need to apply sunscreen regularly, religiously throughout?
So irrespective of you go out of your house, you stay indoors, or you're located on the coast, or you're located on the hill station, or wherever, you need to apply sunscreen. So there's a lot of studies which are coming out saying that there's a blue light which is emitted from your phones, your laptops, your TVs, your lights, so which will all again cause damage to your skin, which will cause aging, will cause pigmentation. So even if you're indoors, you will have to apply your sunscreen regularly. So I'm sure even if you're indoors, your house or wherever you are indoors will have windows, and windows doesn't stop UV rays from entering. So that UV rays will eventually end up falling on your skin. So it's always, it should be like, it should be an habit which you follow regularly. So you start doing this very from early on, like say in your late 20s or early 20s, regularly use a sunscreen. You'll see the effects, you'll see the use of it when you're 30 or, in your 40s or 50s, your aging comes. So you should always apply your sunscreen irrespective of you going out of the house or staying in the house, or, going for any kind of a beach destination. Your sunscreen use should be a regular thing.
Right. And which formulation to go for? Because there are so many formulations available, especially for acne-prone skin type. Which one to go for?
So basically, when you're picking up a sunscreen, you can go with a combination of physical and chemical sunscreen. But the formulation has to be non-comedogenic. So there are the sunscreen which are very oily. So once you apply it on your face, they block your pores, which aggravates the acne. So you should always look for the word non-comedogenic on the product. Okay, so that means they're very thin sunscreens which do not occlude your pores. So the main thing with respect to acne when you're picking up a sunscreen is they should not be comedogenic. They should be non-comedogenic.
Fair enough. And doctor, before we sum up the whole session, any take-home message for our viewers?
Yeah, just consult your dermat for any skin-related issues. So just keep that in mind. You should do that.
Right. So do not experiment with your skin. Your skin being the largest organ of your body, it also reflects what's going inside of our body. So it's important to take care of it. Thank you so very much, Dr. Somashekar, for your valuable time. It has been a very informative session for our viewers, and it was wonderful hearing you. Thank you.
Pleasure. Yeah. Thank you. See you.
And viewers, thank you for joining us in this session. Stay connected to our beautiful Spotless Skin page. Thank you. Have a good day ahead. Keep glowing. Stay spotless. Stay beautiful. Goodbye.